Good morning. My name is Ralf Friedrichs. I'm an addiction recovery coach, a life coach, and host of this show, to Take Your Life Back Today radio show. Also, you can see a video version of this if you go to YouTube under Take Your Life Back Today show. Folks, dementia, warning signs for family members and family caregivers. How to spot early indicators that your loved one may have Alzheimer's or dementia. Friends, from the age of 50 on, it's not unusual to have occasional trouble finding the right word or remembering where you put things. But persistent difficulty with memory, cognition, and ability to perform everyday tasks may be signs that something more serious is happening to a loved one's brain. Dementia isn't actually a disease. According to the Mayo Clinic, it's a catch-all term for changes in the brain that causes a loss of functioning that interferes with daily lives. Dementia can diminish focus, the ability to pay attention, language skills, problem solving, visual perception. It also can make it difficult for a person to control his or her emotions and lead to personality changes. About 1 in 11 Americans aged 65 and older are living with the condition, according to a 2017 study published in the journal JAMA Internal Medicine. A range of brain illnesses or injuries can lead to dementia, with Alzheimer's disease accounting for 60 to 80% of all cases. Diseases that cause dementia. Friends, these conditions are the leading causes of dementia. Many patients have mixed dementia, a combination of 2 or more types, such as Alzheimer's vascular dementia. Alzheimer's disease. Alzheimer's is characterized by amyloid plaques that tangled fibers in the brain and by a loss of connections between nerve cells. Damage initially appears in the hippocampus, an area of the brain involved in memory formation, and gradually spreads. Vascular dementia. The second most common type of dementia is caused from damage to the vessels that supply blood to the brain. It tends to affect focus, organization, problem solving, and speed of thinking more noticeably than memory. Lewy body dementia. Abnormal protein deposits in the brain called Lewy bodies affect brain chemistry and lead to problems with behavior, mood, movement, and thinking. Frontotemporal disorders. Degenerative damage to the brain's frontal and temporal lobes is the most common cause of dementia in people 65 and younger. Symptoms might include apathy, difficult communicating, walking and talking, emotional changes, and impulsive, inappropriate behavior. A loved one showing symptoms of dementia needs to see a medical expert who can conduct tests and come up with a diagnosis. If the loved one has dementia, you want to plan how you will manage that care, especially as the condition progresses as time goes on. But it is also important to rule out other medical conditions such with dementia-like symptoms that may disappear with treatments such as infections and side effects of medications. What to watch for. These are important, friends. Here are some of the warning signs identified by dementia experts, mental health organizations. Difficulty with everyday tasks. Everyone makes mistakes, but people with dementia may find it increasingly difficult to do things like keep track of monthly bills or follow a recipe while cooking. The Alzheimer's Association says to watch for that. They also may find it hard to concentrate on tasks, take much longer to do them, or have trouble finishing them. Repetition, asking a question, hearing the answer, and then repeating the same question 15 times later, or 15 minutes later, or telling the same story about a recent event multiple times are causes for concern. Internist and geriatric specialist Jason Kolowich, a professor of medicine at University of Pennsylvania, noted a 2018 article for communication problems. Observe if a loved one has trouble joining in conversations or following along with them, stops abruptly in the middle of that thought, or struggles to think of a word or the name of objects. Getting lost. People with dementia may have difficulty with visual and spatial abilities. That can manifest itself in problems like getting lost while driving, according to the Mayo Clinic. Personality changes. A loved one who begins to act unusually anxious, confused, fearful, or suspicious becomes upset easily or loses interest in activities and seems depressed is cause for concern. Confusion about time and place. Loved ones who forget where they are or can't remember how they got there should raise alarms. Another worrisome sign is a person becoming disorientated about time. For example, asking on a Friday whether it's Monday or Tuesday, according to Kolowish. Troubling behavior. If your family member seems to have increasingly poor judgment with handling money or neglects grooming and cleanliness, pay attention. Some people who experience memory loss or have difficulty with attention, decisions making, language, or reasoning may have a condition known as mild cognitive impairment. The condition causes a noticeable decline, but the changes are less severe than dementia, and a person that can still perform normal daily activities, according to the Cleveland Clinic. People with mild cognitive impairment are at increased risk of developing dementia. So where do you find help, my friends? When your loved one is displaying trouble or symptoms, a trip to the primary doctor is often the first step. But to get a definite diagnosis, you'll need to see a specialist, such as a neurologist, geriatrician, or maybe possibly a psychiatrist. If you can't find one, the National Institute on Aging recommends contacting the neurology department of the nearby medical school. Some hospitals also have clinics that focus on dementia. Ailments can mimic dementia, so be careful. Any number of treatable conditions can cause dementia-like symptoms. Some of the most common ones are alcohol abuse, anxiety, depression, or stress, blood clots, brain infections, or tumors, delirium, head injuries, kidney, liver, or thyroid problems, side effects of medication, vitamin deficiencies. Folks, specialists will want to know about a patient's personal and family medical history. A close relative or relatives having Alzheimer's is a major risk factor. Recent research suggests that a prevalence among even members of your extended family can increase your dementia risks. Doctors will also conduct physical and neurological exams to rule out other treatable symptoms for dementia symptoms. Some of the methods that doctors use to diagnose dementia is cognitive and neurophysiological tests, assesses language and math skills, memory, problem solving, and other types of mental functioning. Lab tests of blood and other fluids, including checking levels of various chemicals, hormones, and vitamins, can help rule out non-dementia cases for the symptoms. Brain scans such as CT, MRI, or PET imaging can spot changes in the brain structure and functioning. These tests also have identified strokes, tumors, and other problems that can cause dementia. Psychiatric evaluation can determine whether a mental health condition is causing or affecting symptoms. Genetic tests are important, especially if someone is showing symptoms before the age of 60. An early onset sign, Alzheimer's, is strongly linked to a person's genes, according to the Mayo Clinic. Talk with genetic counselors before and after getting tested. Friends, call me at 844-405-HELP. Together we can help each other take our lives back. Be good to yourselves and always be good to each other. Remember, a simple smile to a stranger can help that stranger, can change your life. Dementia, it's all around us. We see it every day, maybe from your neighbors or people down the road. These were the warning signs. May God bless you. Take good care. We'll talk to everybody tomorrow. And if you have somebody who has dementia,